My father was a physician, a few uncles who were physicians, so I grew up in a medical environment. And I grew up watching the very special relationship between patients and physicians. I grew up in a relatively small town in northern Lebanon, so it was a very individual relationship with physicians. I chose laryngology because I love the fun of seeing conditions that are fairly varied, and then you do a lot of clinic work, you do very interesting surgeries, and then the ear was just fascinating. It's a perfect mix of biology, surgery, physics, electronics, and of course, patient care. I've developed a keen interest in balance relatively soon after I finished training, and I realized that's a field that's not very well served, so patients struggle a lot. One of the big things that we always talk about is really listening to the patient. Surprisingly, most patients with dizziness, they will pretty much give you the diagnosis if you give them enough time to just tell you the story. And that's how I always start my discussion with patients. I walk in and I say, tell me the story in excruciating details. And often patients are surprised because they're like, you really want all the detail? And I say, yes, I want all the details because it's the details that matter in patients with dizziness. Seeing somebody feel like they can go out in the garden and take care of their garden, or they can go to their social event, or they can go to their family meetings, that's phenomenal. And it's the same thing for our hearing patients. And we help patients with hearing loss through either hearing aid or cochlear implant or surgery if they're good candidates for surgery. Also seeing that the change that makes in their life in terms of improving their interaction, being able to go back to a normal lifestyle where they don't feel isolated and disconnected is just amazing.